Since bursting onto the World Championship scene in 1996, Valentino Rossi has become an iconic figure in motorcycle racing. He's won 8 world titles and 101 Grand Prix. Every one of those successes has been achieved with a free-spirited desire to entertain, which, together with his sublime talent, has changed the face of motorcycling and made him the most charismatic man in motorsport. 30 years ago, another hugely popular figure was making his mark on the Grand Prix circuit. Randy Mamola was regarded as one of the most gifted racers of his generation. A consistent challenger for the world title throughout the 1980s, Mamola stood on the podium 57 times, finishing as championship runner-up on 4 occasions. During a career in the Premier class that spanned 14 years, Mamola raced alongside the likes of Barry Sheene, Kenny Roberts, Eddie Lawson and Mick Doohan. He's widely considered to be the best rider never to have won the world title.
You know, a lot of people said I clowned around too much and, you know, didn't focus enough and so on. I did it my way. And listen, I'm an entertainer. I want to be in front of the camera. I want to feel the need from the fans because I give what they need back. That's who I am.
After retiring from racing in 1992, Mamola became a Grand Prix test rider before going on to forge a successful career in the media. He still loves riding motorcycles, and for the last few years he's helped some high-profile fans to experience the thrills of MotoGP firsthand, giving pillion rides on a specially converted Ducati. However, the principal passion in Mamola's professional life is riders for health. In Africa, thousands of people die every year from easily preventable and curable diseases such as malaria and tuberculosis. Although billions of dollars are spent on drugs to cure such diseases, they often don't reach the people who need them most. One of the principal reasons for this is a lack of infrastructure for the drugs delivery. Vehicles for the provision of healthcare operate in harsh terrain. Without routine maintenance, they break down and the healthcare programs fail. Health workers typically have a caseload of around 20,000 people spread throughout several villages, which can be anything up to 30 kilometers apart. Very simply, no transport means no healthcare. Riders for Health focuses on managing fleets of motorcycles and ambulances so that health workers are able to reach even the most isolated communities. Founded over 20 years ago by Mamola, his then PR manager Andrea Coleman and her husband Barry, Riders for Health currently works in 6 African countries.
The impact that we've seen is huge. You can immediately see a drop in diarrheal diseases, babies dying of diarrhea in rural communities. You can immediately see a difference in compliance with HIV and antiretrovirals. You can immediately see that TB patients don't have to be in hospital where nobody can visit them. They can be in their own communities and the healthcare worker comes and treats them in their home-based care. So the impact is huge and it makes such a difference.
Riders' work starts with the technician, someone who's trained to ensure that the motorcycles never break down and that health workers are capable of performing routine maintenance. All programs are managed by wholly African, wholly professional teams rather than by volunteers or expatriates. This means that Riders is able to build a lasting base of local knowledge in the communities it works with.
What's important to us is to be able to put the infrastructure in for running vehicles, motorcycles and four-wheel vehicles in a country, but to be able to scale it up and roll it out, because we know that transport and managed transport is going to make a huge difference to the health of Africa over time.
Riders for Health is the official charity of MotoGP, and their principal fundraising event, the Day of Champions, takes place every year in the run-up to the British Grand Prix meeting. Featuring a variety of motorcycle-based attractions, the Day of Champions gives Riders for Health the opportunity to raise awareness about their work and offers fans the chance to see their favourite riders outside of the racing environment. The highlight of the day is the auction, where motorcycling stars, past and present, donate various items that the public can bid for.
Valentino Rossi gets up on stage and, you know, it's just so funny. The euphoria that he creates, signs a hat, 2,000 pounds. You know, just the bidding war that goes on. He takes stuff off of his body to give to us. You know, he knows how to play it because he's the master of all that, and he is the ultimate entertainer.
2,200 pounds, really good.
This whole day, Day of Champions, allows them to come to the paddock, allows them to come closer to the riders. And this, in turn, has made it better. When the younger riders see someone like Valentino doing these things, it gives them a boost of wanting to do it.
1,000 pounds, the bid's here. 1,000 pounds, a bit, 1,000 bid, 1,000 pounds, a bid, last call.
The auction generates the vast majority of the day's takings, raising nearly $300,000 for Riders for Health.
£1,200 a bid, looking about. £1,200, the hammer's going down, sold this time at £1,200.
In addition to co-hosting the event, Mamola puts up some of his own vintage leathers for auction.
Randy Mamola has a huge heart, and not only has he a huge heart, but he's a great communicator, and he's been able to use that ability to communicate to draw people to the movement that is Riders for Health. His support, to me, is very important. The work's hard, and to have Randy being supportive, always believing in what we're doing, is extraordinary, and we couldn't do without it.
Over the past 20 years, Riders for Health has created a system for managing vehicles in Africa which can be applied across the developing world. Its work has been profoundly beneficial and has the potential to transform healthcare throughout the continent.
The great thing about Riders for Health and the great thing about our sport is anybody who rides a motorcycle knows it puts a smile on your face. Absolutely. And that's what we're doing in Africa. The same tool that I used all my life to give me a passport to fly around the world is the tool that's saving millions of people's lives.